Hi everyone, welcome back to Dr. Kernu's workshops. Today we'll be presenting part one of a three-part series on congestive heart failure. So here we're going to be talking about what is congestive heart failure, what is the anatomy behind it, like how is your heart working to compensate when it's working overtime, and also we're going to be talking about shortness of breath, and then also some tips about how can you manage heart failure and improve your quality of life. My name is Monica, and I'm joined with Ivy.
Hi, my name is Ivy.
We'll be co-presenting today for this workshop. So to start off, we actually have a fun icebreaker activity that will get you thinking a little bit. So we have a patient. Their name is Stethoscope. He's a 63-year-old male, and he came to the clinic presenting with a history of 2 heart attacks. And then also they've had hypertension, so a high blood pressure, and they also suffer from type 2 diabetes. And they came to the clinic because they've been feeling very short of breath for the past 4 months, extra tired more than usual. And Dr. Kernu ordered a special blood test called the BNP test, and the results were 600 picograms per milliliter. Now, if you're not aware of what this blood test is, don't worry, we will get to it in part 2 of the series. Their blood pressure in clinic measured to be 98/82 with a heart rate of 110 beats per minute. So the question is, what do you think the diagnosis will be for this patient's case? If you guessed congestive heart failure, you would be correct. Of course, the diagnosis involves a lot more details and appointments with Dr. Kernu to ensure that the correct diagnosis is presented, and Dr. Kernu is very thorough with his evaluations, but we just wanted to give a quick, brief summary of what you can expect to see in a congestive heart failure patient. So without further ado, let's jump right into it.
So if you ever find yourself short of breath at rest, short of breath during any physical activity, or waking up at night to catch your breath, those are all symptoms of congestive heart failure, like our case study stethoscope. And we'll be going into sort of how or exactly what is congestive heart failure and the anatomy behind it right now. So what is congestive heart failure? Well, if we look at our heart as a pump for blood around the body, congestive heart failure is when the pumping action of the heart isn't actually strong enough to move the blood around, and therefore the heart can't meet the body's need for oxygen. What happens is the heart begins to pump at a higher filling pressure, and eventually fluid builds up around the heart and eventually begins to back up into the lungs, the liver, the abdomen, and the extremities. So our bodies are actually quite good at compensating for heart failure in the beginning stages. And since heart failure is the heart's inability to pump blood, the goal for compensation is to usually increase cardiac output. And our body can do this in 3 ways. So the first way that it can increase cardiac output is by enlarging or stretching the heart, as we can see on the image to the left. So this stretches out the heart and allows it to fill with more blood, and so it can pump more blood around the body. And this works in the short term, but in the long term, this leads to a thinned out heart muscle and the heart begins to get very weak. Our second way of compensating is by increasing muscle mass. So the contracting cells of the heart actually get larger, as we can see on the picture to the right. And similarly to the first method, it also works in the short term, but in the long term, it actually decreases the elasticity of the heart and decreases ventricular volume. So if we take a look at the picture on the right, we can see that the heart can't really fill properly because the heart muscle walls are too thick. And the third method for compensation would be to pump faster. And similarly to the other two, this also works in the short term, but in the long term, it increases strain on the heart. And now we'll take a look at an animation that shows the first compensation method. So here we can see an animation of a normal heart. Take a look at the muscle wall and the heart rate. And as we can see, everything looks pretty normal. And then if we take a look at the animation of the heart with heart failure, we can see that the ventricles are enlarged, the heart wall is pretty thin and weak, and we can see that the heart rate has increased slightly. Now, there are a few causes for heart failure. The first one is coronary artery disease. So this happens when there's a buildup of fatty deposits or plaque in your arteries. This reduces blood flow in the arteries and could lead to a possible myocardial infarction or a heart attack. As we can see on the picture to the bottom right of the screen, the left of the picture is a patent artery, so the artery has no plaques. The right of the picture is when an artery has a plaque, and as you can see, the walls of the artery are narrowed and causes restrictions in blood flow. The second possible cause of heart failure is hypertension. So hypertension is when we have a chronic high blood pressure, and this extra exertion on the heart muscle can make it either too stiff or too weak via those compensation methods that we talked about in the previous slide. And it makes it too stiff or too weak to effectively pump blood around the body. And the third cause of heart failure is valvular heart disease. So this is when a valve in the heart is damaged due to heart defect, coronary artery disease, or heart infection, and it forces your heart to work harder, which weakens it over time. And the final cause of heart failure is lifestyle. So things like a sedentary lifestyle, smoking, or drinking can lead to a higher risk of heart failure. And now, an interesting fact is that over 600,000 Canadians live with heart failure daily, and up to 40 to 50% die within 5 years of their diagnosis. So this is clearly a big problem that we need to manage properly. So now we're going to take a look at some symptoms of congestive heart failure, and we're going to do a little categorization activity. Keep these words in mind, and we're going to use them to do a little activity. We're going to categorize them based on symptoms that you may notice first, symptoms that indicate your condition has worsened, and symptoms that indicate a severe condition. So the three words or the three symptoms that we have chosen for this activity are fatigue, blue skin or cyanosis, and an irregular heartbeat. So if you want to guess where these symptoms fall within these three categories, feel free to pause the video and try to guess. So it turns out fatigue is actually a symptom that you may notice first. An irregular heartbeat is a symptom that could indicate your condition has worsened. And finally, skin that appears blue or cyanotic is a condition that indicates a severe heart condition because it is a sign that you have hypoxemia or not enough oxygen in your blood. Now, along with fatigue, some symptoms that you may notice first or in an early stage of heart failure would be some swelling in your ankles, feet, or legs, weight gain, or an increased need to urinate, especially at night. Along with an irregular heartbeat, some symptoms that you may notice when your condition has worsened include a cough that develops from congested lungs. Remember, fluid backs up from the heart and into the lungs. You may notice some wheezing or some shortness of breath, which may indicate pulmonary edema. And then some symptoms that indicate a severe heart condition among cyanosis would include chest pain that radiates throughout the upper body, rapid breathing, or fainting. And there are 4 stages of congestive heart failure. So in the early stages, or stage 1, you may experience a bit of breathlessness or tiredness with a brisk walk, jog, or up a flight of stairs. And usually you might not even experience any symptoms during typical physical activity, but when overexerting yourself, you may notice some shortness of breath. At this stage, congestive heart failure can still be managed through lifestyle changes, medications, and monitoring. In stage 2, you might be still comfortable at rest, but any normal physical activity may cause some fatigue, some palpitations, some shortness of breath. For example, when taking a walk around the block or running up some stairs. And at this stage, similarly to the first stage, CHF can still be managed through lifestyle changes, through medications, and through close monitoring. In stage 3 here, we can see that patients may experience some palpitations or tiredness with even the simplest of tasks. So you may notice that there's a noticeable limitation in your physical activity. So even mild exercises can cause shortness of breath or fatigue, just like walking up from the sofa or walking over to the kitchen. At this stage, treatment can be complicated, so it's good to talk to Dr. Kernew about what heart failure at this stage means for you. And then stage 4 is our final stage of congestive heart failure. And at this point, the heart and the breath are increased in rate even at rest. You may feel tired, short of breath, and fatigued even when sitting, and palpitations may occur at all times. There is no cure for congestive heart failure at this stage, but there is still quality of life and palliative care options, and you should discuss the potential benefits and risks of these options with Dr. Kernew. So there are also different types of heart failure, and so we have 4 listed here. We have left-sided heart failure, right-sided heart failure, systolic heart failure, and diastolic heart failure. So with left-sided heart failure, fluid may back up into your lungs, which causes shortness of breath. And with right-sided heart failure, so this is heart failure that happens on the right side of your heart. In this type of heart failure, fluid may back up into your abdomen, your legs, and your feet, which causes swelling in those areas. With systolic heart failure, the left ventricle can't actually contract vigorously, which indicates a pumping problem. So this would be an example where your heart begins to compensate by enlarging, and so it can't pump because the walls of the heart are too thinned out and too weak. And then we have diastolic heart failure, and this is when the left ventricle can't relax or can't fill fully, and this indicates a filling problem. And so this happens with the second method of compensation, where your heart begins to increase in muscle mass and decrease the elasticity of the left ventricle. So keep in mind these 4 types of heart failure, because in part 2, we'll discuss them and we'll see how they relate to sort of treatments and management options.
So thank you for joining us. That was great, Ivy. Thank you. And we hope you are looking forward to part 2. If you have any questions, please feel free to reach out to Dr. Kernew or the clinic and ask them, and we'll be sure to try to address them in part 2 and part 3 of this series on congestive heart failure. Stay safe. We hope you're doing well, and like, subscribe, comments.